Hi, my name is Micheal Fine, and I'm an Illinois medicinal cannabis patient, and I'm here to tell you a little bit about my story. Approximately 6 years ago, I was in a terrible car accident and hit head-on by a truck at 50 miles an hour, which severed my left arm at the shoulder. Since that time, I've suffered debilitating pain as I still feel my left arm as if it was attached to my body. The name of the syndrome is called chronic residual limb pain syndrome. I've tried every known narcotic and other form of pharmaceutical treatment, from Norco to Vicodin to Oxycontin to methadone to morphine, you name it, I've tried it. Strung out on so many different medications and taking medications for the side effects to the medications that I was fortunate to eventually turn to some non-traditional treatments and eventually medicinal cannabis, which changed everything for me. At present, fortunately, the dispensaries are opening, but in an incredibly slow and backward manner in our state. The bureaucracy has been ridiculous, and the problems that we're having as patients now are that we have a card that is valid for a year and a program that was supposed to be a 4-year pilot program that now is really only a 2-year program based on purely political agendas. So cannabis for me versus narcotics, it really is like a separate world entirely. You know, all of the fallout and baggage that you hear associated with narcotics, many of which I've experienced, the problems with my stomach and constipation and all the different things that are side effects, I have none of those with medicinal cannabis. You know, the narcotics were great at taking away pain, but they took everything else away with it. The medicinal cannabis is a very different way of really not taking the pain away, but really taking my mind off of the pain and just putting me in a whole different mindset where I'm not thinking about being in pain all the time. And I'm in a state where I'm coherent, I'm able to go about my daily activities and not have the just the completely zoned out, you know, almost sedation-like effects of the narcotics. I don't have that at all with the cannabis. So a couple of the particular strains that I found very helpful with my condition, again being chronic residual limb pain, phantom nerve pain. One of the strains is called G6, which is just fantastic as far as an up feeling and really helping me to take my mind off of the pain. Another strain that is also great for pain, and the G6 I believe is an indica blend. This is a sativa strain called Harley Sue, which I also have, unfortunately, some other pain-related issues with nerves that have popped in my neck and my shoulder due to the unequal weight distribution of only having one arm, and that's been a recent thing for me. And the Harley Sue has been fabulous for that. The key to success in the future in this industry is that our state needs to get with the program that is taking place all over this country and approve the additional conditions that have been attempted to be added for more patients to be able to take advantage of this medicine. And it is medicine in the truest and purest sense of the word. And once that happens and everyone sees that the sky doesn't fall down, the state is generating money and tax dollars that it didn't have, and everything else is going along just fine like it has in Colorado and in California and many other states across this country, we'll see that this is really a solution to so many problems, and it could help people live in a quality of life that narcotics cannot.